Vaccines are really the best way to protect your infant against a number of very serious illnesses. Infants who aren't vaccinated are more likely to get whooping cough, which can cause spells where they are unable to breathe from the thick mucus that the infection causes in their respiratory tree, and it can cause infant death for that reason. Most babies who get pertussis end up in the hospital. Other illnesses that infant vaccines are going to protect your baby against include neonatal tetanus, which is uncommon because we give the vaccine to mothers as well as babies, and also polio, various forms of meningitis and pneumonia, and rotavirus, which is a real serious form of diarrhea and vomiting that often hospitalizes babies. All of these infections can be easily prevented through vaccination. Vaccines are really safe. They've been well studied to make sure that they can prevent the serious infections that we're trying to prevent without causing infant harm. Some vaccines will cause a little bit of fever or a little bit of soreness in the leg, but by and large that's the most you can expect them to do. Vaccines work by imitating the evil viruses and bacteria that we're trying to prevent. They are like a copy of the coat that the virus or bacteria wears. You recognize that I'm a doctor because I'm wearing this white jacket, and if the white jacket entered the room without a doctor inside it, you'd still know it was a doctor's jacket. In the same way, vaccines work by teaching our bodies to recognize those coats that the viruses or germs carry, and that way we don't have to be exposed to their DNA that's really the source of their reproducing themselves and causing the infection. So it's a really very safe and natural way to learn to recognize the bad germs that can affect our infants and cause them serious consequences. The first vaccine infants should all get is hepatitis B vaccine in the birth hospital. And the reason it's offered so soon is because it's as safe and effective in a newborn as it is in an adult. The next vaccines that your baby will be offered are at 2 months of life, and that includes the whooping cough vaccine, tetanus, diphtheria, polio, 2 types of meningitis vaccine, and rotavirus vaccine. Don't worry, that sounds like a lot, but there are combination vaccines in use, so it's not that many shots, and the rotavirus vaccine is given by mouth. Vaccines are safe in the combinations that we give them. A lot of people worry that we're giving too many vaccines too early or that it will overload a baby's immune system, but really that's not the case. It's really very safe and effective to give these combination shots and to give vaccines at the current schedule that they're recommended. That's all been well studied. There are actually a couple problems with that. It's been well studied that vaccines are a stressor. Infants don't like them, children don't like them, but one vaccine is not any less stressful than getting 5 at once. And so that's actually been studied by measuring cortisol levels and adrenaline levels and infant pain scores. So we know that getting the vaccines in combination is a stress, and that spreading it out, one here, 1 in 2 weeks, 1 in 2 months, only means that you've now got 3 or 4 or 5 different episodes of stress that you've exposed your child to. And of course, it's going to make them more fearful of going to the doctor when they don't need their shots. The other thing is that those alternative schedules have not been well studied as far as efficacy of the vaccines, and they prolong the risk that your child will catch the real deal until they're vaccinated. So what you're really doing is, eliminating what you perceive as a risk, getting shots all at once, and accepting the risk that your child will not be protected when the real deal comes along. And so it's been shown that families that delay vaccinations actually are more likely to have their child experience one of those preventable illnesses.